Tuesday morning saw a steady stream of patients leave the Coast General Hospital, a section of patients opting to seek treatment elsewhere as a countrywide nurses' strike entered its second day, with 6 patients at the facility confirmed dead. According to Mombasa County Chief of Staff Dr. Khadija Shikeli, the first 3 patients died on Monday, the first day of the strike. 3 others died on Tuesday.
The third patient that died in casualty was a patient who was being followed up and treated for HIV and TB, but had come in very ill also, and he actually succumbed to his disease. The other 3 patients died in the wards.
For a second day, several patients were turned away at the gate, stranded after the provision of healthcare services was halted in all public hospitals across the county.
Na mtoto wangu huyu alifanya operation ya mkono, na imesemekana mpaka atolewe waya ndio aweze kumesajiwa mkono unyoroke. Na sasa madaktari wamegoma. Ndio nilikuwa nauliza mtoto atakaa na hiyo waya mpaka madaktari watakaporudi, na sijui atarudi muda gani.
In Nakuru, the county's main referral hospital stopped admitting new patients, with doctors discharging those in the wards. Patients who had been involved in road accidents were hit hard as they were left unattended. A state of affairs that was replicated in health facilities in Machakos County. Across the country, nurses under the umbrella of the Kenya National Union of Nurses vowed not to return to work until their collective bargaining agreement was signed. On Monday, the Council of Governors shifted the blame over the delay in the signing of the CBA to the Salaries and Remuneration Commission, saying the SRC was yet to approve the draft CBA it had drawn up in consultation with the nurses.
Once SRC makes a pronouncement on the matter, county governments will go ahead, together with national government, will go ahead and sign a CBA with the nurses union.
The SRC now coming out to absolve itself of blame. According to the Commission Chair Sarah Serem, the COG negotiating team had failed to adhere to the guidelines, eventually tabling a CBA that required an amount far beyond the parameters provided.
The Commission is but constrained because all we have asked, and in the guidelines we have given, every time that you sit to negotiate, ensure that you have a financial implication and a funding to support every projected, anticipated funding on the same. This is all that SRC is asking.
Further, the Council of Governors could not explain how counties intended to fund the proposals in the draft CBA. SRC says the Council has now owned up to this mistake.
Have, in the last 24 hours, engaged with COG. And they have committed and actually agreed that the whole process of collective bargaining agreement was an error, bearing in mind that whatever the negotiating team came up with was not approved by COG itself as a body. And it is something they are yet to interrogate.
The amount required still unclear, with the COG claiming what the nurses had asked for would require about 40 billion shillings annually, while nurses held that they would require 28 billion shillings disbursed in 4 phases. The SRC now urging the parties to return to the negotiating table. The Labour Ministry has now offered to mediate talks between the parties. Cabinet Secretary Phyllis Kandie calling the 2 sides to a conciliation meeting on Wednesday. Wilkister Nyabwa, The Big Question.